I'm Roby Brock. Welcome to the program. I am joined by Arkansas's Insurance Commissioner Allen Kerr, an old friend of mine. I have known you for 25 years. I think I would put it in there. It has been.
In fact, we were going to church together.
That's right. That's where we first met. So good to see you, and thanks for being here. Open enrollment period has begun in the state of Arkansas. What is that, and how long does it last?
Open enrollment is for the health insurance marketplace. It starts today and goes through December 15th. And that is everyone's opportunity who don't have insurance to go online and sign up, or they can get help through our helplines and get the insurance that they need. If they've got current insurance, they can make changes in that insurance if they want to during this open enrollment. If they don't want to make any changements and they've got a policy now, they don't have to do a thing.
Tell me what, you guys have taken the health insurance marketplace under your umbrella. It was an independent organization. What have been some of the advantages of moving it under the AID umbrella?
Well, one of the biggest advantages is the cost savings. We have done away with that, that government agency and saved the ratepayers of Arkansas $13 million a year. So I took that $13 million and pushed that down to the ratepayers, and that is calculated into your insurance premium this year, and resulted in a much lower increase than they would have had they not done that, and a lower increase than we have in the past. So we're looking at about 2% overall as an increase. So most people with their policies won't notice a big change.
So you're touching on a subject that I have to ask about. Every year health insurance goes up for just about everybody. Has health insurance ever gone down for anybody?
Believe it or not, when I say an average of 2%, that means that it may be 2 or 3, 4% for some people, but it has to go into the negative territory for some other people. So yeah, some folks will see a reduction in their health insurance rates.
Wow, I'm not going to be one of those based on what my carrier has told me so far this year, but I've got a private plan. So.
Well, based on the times that I see my doctor, mine won't go down either.
Arkansas Insurance Department is also helping with Medicare open enrollment this year, and that runs through December 7th.
Yes, sir, December 7th.
To explain to me what your role in that will be and how you guys will be helping folks navigate that.
We have a federally backed division of the Arkansas Insurance Department called SHIP. It's our Senior Health Insurance Initiative program. And we have a group of people there that are there simply to help people navigate signing up for Medicare insurance. In other words, if they need a supplement in addition to Medicare, what's Medicare all about? What's Medicare Part A, B, C, D, E, F, G? I mean, there's a whole bunch of them.
It's alphabet soup there.
Alphabet soup.
I've had to help my folks navigate through that some.
And and everyone is going to hit that point where they need to deal with that. So they are there. Super group of people we have there. Our group actually trains the volunteers across the state in various agencies. Area on Aging is one of them. To help those folks out in the state navigate through the Medicare process. If they want to call our office direct, they may do that. Go online and all that information's there. But yeah, they're there. We help thousands of people every year to sign up for Medicare.
Arkansas's insurance markets have been relatively stable, particularly when you look at other states, I would say. Why do you think that is? Well,
national average is a lot of states are very unstable. Arkansas has been one of the most stable and is getting more and more stable as we go forward. It's the efforts of the governor, the legislature, and the insurance department working together with that one goal in mind: make it affordable, make it comprehensive, and accessible to everyone.
Is it more competition in the marketplace? Does that help?
More competition always helps. Always helps. We've got 3 large companies operating in that market space right now, and we are always looking for more to bring more to Arkansas.
I'm sure those 3 competitors don't appreciate that, but
they don't appreciate that at all.
All right, let's talk about another issue that is under your umbrella, PBMs. Give me an update. The legislature moved some oversight and regulation of the pharmacy benefit managers.
Pharmacy benefit managers. That's that entity that most people don't know about, and I really didn't know about till I got into politics. But PBMs basically is the management system between the insurance company and the pharmacist. So when they say pharmacy benefit manager, that's pretty much what they do. They manage that flow of prescription drug payments that the insurance company pays for, and that the pharmacist gets.
The controversy was about a year and a half ago, or maybe a little bit more than that. The rates went up at the beginning of the year for a lot of the pharmacies in a way that they claimed were unsustainable. The legislature met in special session and put some of that regulation in your shop there.
What was happening is the PBMs got a little greedy, and they started charging a little more spread. In other words, they were charging, taking quite a bit of that chunk of money that the insurance company pays down to the pharmacist. Well, they were keeping a little too much of it. So much so that the pharmacists were making less than what they were paying for the prescriptions. Right. So the governor jumped into action, had a special session. The legislature passed a law that put them under our purview. Before that, they weren't really regulated. Now they are. So we go in and audit the PBMs, making sure they're not using that spread pricing, and so that the pharmacists get their due share, and that the citizens of Arkansas have access to their pharmacies.
Do you feel like that has worked well? Do you feel like it has been the remedy that the legislature wanted it to be?
Well, you know, and funny thing about it, my mother always said that people do what's inspected, not what's expected. Okay? So now that we're inspecting them, the complaints have dropped dramatically.
Yeah.
And they're playing nicer than they were before.
All right. Well, keep us posted on that. All right. Open enrollment period lasts till when?
To December 15th.
December 15th.
Yeah.
All right, everybody, take a look at what you got in terms of your options there.
Yes.
Allen Kerr, thank you very much.
Thank you.
Appreciate it. All right. That's all for today's program. I'm Roby Brock. Thanks for tuning in. We'll see you next time.